I'm delighted to say that our keynote speaker is the Honorable Mrs. Mary Robinson, the first woman president of Ireland. She is now an adjunct professor for climate justice at Trinity College, Dublin. She's chair of the Elders Group, which has been such an important body advising the world on issues like climate change and the pandemic response. She is also a past commissioner of the UN Human Rights Council. She received the Presidential Medal of Freedom from US President Barack Obama. Between 2013 and 2016, she served as the UN Secretary General's special envoy for 3 different roles: for the Great Lakes region of Africa, on climate change, and most recently as the UN Special Envoy on El Nino and climate change. She will be followed then by our 5 invited speakers, a distinguished group of scientists, economists, and political leaders, really from across the spectrum. First off will be Professor Paolo Sirico from the London Business School. He's a professor of economics, and he is also a research associate at the London School of Economics Center for Macroeconomics. Before joining the London Business School, he was an advisor on monetary policy to the Bank of England. So he is, of course, going to speak to us about issues related to Brexit, income inequality, climate change, the rise of populism, and how all of those features have been impacted by the COVID pandemic. He will be followed by Professor Andrea Gagliotti, also from the London Business School. He is a professor of economics at the European University in Florence as well. He's an expert in microeconomics, industrial organization, and game theory. And he is also the managing editor of the Review of Economic Studies. He will be followed by my friend and colleague, Professor Sir Andy Haynes. Andy Haynes was director of the London School of Hygiene and Tropical Medicine from 2001 until 2010. He's a member of the Intergovernmental Panel on Climate Change, the 2nd and 3rd assessment exercises, and was review editor for the health chapter in the 5th global assessment. He chaired the scientific advisory panel for the 2013 World Health Report for the WHO, and he also chaired the Rockefeller Commission on Planetary Health, which helped found that new field and for which I was honored to serve as a commissioner. He will be followed by Dr. Sherry Weiser from the University of California, San Francisco. She's a professor of medicine and an internist at UC San Francisco's Division of HIV. Her research focuses on the impact of food insecurity and other social and structural factors on treatment outcomes of HIV and other chronic diseases. She's published multiple manuscripts in the food insecurity area, and she's going to talk to us about the food insecurity impacts of COVID-19, which of course have been so substantial in so many low and middle income countries, and indeed in some high income countries like my own, the United States, where income inequality has already been a sharp divide, and where COVID-19 and its impacts have really exacerbated food insecurity, even in a country as wealthy as the United States. Finally, our last speaker will be the Honorable Mrs. Laura Chinchilla. She was the first woman to be elected president of Costa Rica from 2010 to 2014. Previously, she had served as a Minister of Public Security, as a Congresswoman, as Costa Rica's Minister of Justice, and also as the Vice President of her country. She's a fellow at the Institute of Politics and Policy and Public Policy at Georgetown University here in the States, and also is an invited professor at the Instituto Tecnológico de Monterrey in Mexico and the Universidad de São Paulo in Brazil. So a true internationalist, and she is going to speak to us about the political implications of COVID-19, again, beyond the health response. And of course, unfortunately, Central and South America currently are being extremely hard hit by the COVID pandemic, with Brazil being the second most affected country in the world after my own. So truly a distinguished panel. And as I said in my introduction, I will be back to see you again after the Honorable Mary Robinson's keynote and these 5 wonderful talks. Thank you for your attention, and look forward to an extraordinary session with some really very, very special invited speakers.
I'd like to thank the International AIDS Society for the invitation to take part in this virtual COVID-19 conference. I chose the title COVID-19, a mirror to help plan a better future. And I want to explain why I chose this title. And I want to go back to January of this year, 2020. I was feeling very depressed and down because I was very concerned about the climate crisis, and I didn't see that the world was really ready to have that ambition that was needed. And I'm chair of the elders that Nelson Mandela brought together, and we're not allowed to be depressed and down. We have to bring hope. So I was disguising how depressed I felt, but I actually was very worried because I couldn't see how we would get on track for a safe world for our children and grandchildren, despite the children being out there in their millions for Fridays for Future, begging us to listen to the science and to be prepared to do something. We knew from the Paris Climate Agreement, and I was the special envoy of the UN Secretary General at the time, that we had to reach a goal of well below 2 degrees Celsius of warming, and preferably work for 1.5 degrees. But actually, so they mustn't be forgotten as we make the transition. But what about developing countries? I was the special envoy of the UN Secretary General at the time of the Paris Agreement. And before it, all countries made commitments. And developing countries, one after the other, made commitments to go as green as possible, clean energy as possible. But they said, we will need the technology, we will need the investment, we will need the training, we will need the skills, we need the solidarity. And actually, they haven't had that much support to go as green as they would wish. And meanwhile, they've been finding reserves of oil and gas in particular, but also coal. They probably already knew the coal was there. So what are they to do? They've got to bring their people out of poverty. Are they to go the dirty route and endanger the whole world? Or will we help them enough? That's another challenge of climate justice. And the fifth challenge, I have to honestly say, is the one I came to much later, but is so important, is the injustice to nature herself. Look at that biodiversity report in May 2019, telling us what we were doing to our world, the potential extinction of 1 million species. The fact that we weren't living in a way that was sustainable with Mother Earth. We were endangering the planetary boundaries. And we were just not taking into account the loss of biodiversity and the way in which this was affecting all aspects of life and the future. So combining these 5 layers of injustice, then what are the lessons that we can learn from COVID-19? Because it has been both devastating and exacerbated the inequalities, but it has also been a moment to learn lessons. So we've all been locked down in our different parts of the world, in different circumstances of great inequality. But nonetheless, there's been something leveling about the fact that we've had to comply with staying locked down at the beginning of this COVID-19. And the more we've done that, the more it has addressed the virus, because we don't have a vaccine. It's our collective behavior in obeying the lockdown and social distancing, which is helping to protect those more vulnerable, elders like myself, but also health workers and care workers and frontline cleaners, all those key workers, many of them women who are often low paid, but they are the key workers in an emergency, which is something also to remember. And collective human behavior will be very important when we are coming out of COVID-19 in addressing the other crisis which hasn't gone away, the climate crisis, because we need to think about the kind of throwaway, plastic-ridden society that had developed. Very different from what I grew up with, where we learned to darn, we learned to sew buttons, we learned to have hand-me-down clothes. I'm now moving back to wanting that kind of world again. I'm going to get into slow fashion. I'm a jackets person. I have enough jackets to last me for the rest of my life. I'm just going to put a few away. I haven't changed size. I'll take them out and recycle them. And that will do me. I've gone off meat. I'm a pescatarian. Little things. Most importantly, I'm going to travel much less. These are all things that I am learning that in my behavior. If all of us could take some lessons in our collective behavior, that will help greatly as we address the climate crisis. The second lesson of COVID is that government matters. It matters a great deal. We are actually witnessing very visibly good government and government that has not taken the crisis seriously enough. Now, there is a mixture between those countries that do it democratically and those who do it more forcefully, if I could say, and I'm not too much in favor of that. But interestingly, it is women-led countries that have actually tended to do better in the democratic space. Countries like, for example, Angela Merkel in Germany, yes, they've had a resurge, but they're coping with it. The prime ministers of Norway, Denmark, Finland, Iceland, Jacinda Ardern, yes, New Zealand was free of the virus and it's come back a bit, but they're coping. And the president of Taiwan. These women took tough decisions early, listened to the science and brought their people with them and then began to ease up, and they're seeing some problems that we can all learn from. Because other countries that are coming out later need to know. But think of the countries, including rich countries, where you've had bad, lazy, or inattentive government not paying attention to the science or wanting their personal ambition, their election ambitions to outweigh taking seriously. Populist leaders who really have been very dangerous for their people. The verdict on them will be very cruel as we go forward, because it will be very, very evident what countries coped well and did not. And there is no excuse for those countries that didn't pay attention to the science, didn't have the testing and tracing, didn't have the steps to protect their populations. So government matters. And the children will be delighted to think that maybe science matters much more now. Because look, we've been watching many countries with politicians side by side with their health experts, and the health experts have been guiding them on the steps to be taken, how long will the lockdown be, what phase is next, how will we come out of COVID. It's been the science, the health science, that has guided us. We need to get into that relationship with climate scientists. We really do, so that the science guides us to get to where we need to be in having a good world for the future. And then another thing, and it's a more subtle thing, but I like to talk about it. I believe that compassion matters. I think that COVID has had an impact on all of us, locked with our families, learning those relationships again, coping with a lot of issues, especially in abusive households, very negative issues. But by and large, it has opened us to the suffering of others. It has made us more have more empathy for that suffering. When I would talk in the past about climate justice, and I would refer to small island states and indigenous peoples and the poorest countries, people often looked at me quite blankly, more or less saying, well, that's not me. And they didn't really empathize. Now I think we have this kind of openness to the suffering of others, and openness to the fact that it is devastating, more devastating for countries in Africa, for example, because they're not getting remittances, because those who were sending remittances are out of a job in the industrialized parts of the world. The capital has flown from African countries. They need enormous debt relief. We need a huge solidarity. What we need in building back better, and that's the next part of what I wanted to talk about. We need to ensure that we have a recovery package, not just for the rich countries and the European Union's recovery package, which is really remarkable, but also for the G20 moving in for the rest of the world with debt relief of a very significant sort and a recovery package that recognizes that it affects poorer countries so devastatingly. And then we need the two ways to come out of the climate crisis. We need the new Green Deal, Green New Deal, with its clean energy and its clean green jobs. And we need the biodiversity, the reforesting, the rewilding, the drawdown recommendations of how we address that issue. And we need to do it not only fairly, but in a way that really recognizes that the business as usual was not a good world in many, many ways. It was not leading to a safe world because it was not dealing with the climate crisis, but it was a very unfair world. Now we've learned how vulnerable humanity is. Can we learn the first article of the Universal Declaration of Human Rights, that all human beings are born
restaurant, traveling, hospitality, recreation, whereas at the bottom of the income distribution, most of the basket is unessential. We can go as far as asking how much each group contributed to the drop in aggregate consumption. And the striking feature of the UK, but also many other economies, is the top 25% of the income distribution account for 46% of the drop in aggregate consumption. Why this is important? Because if you look at each individual sector, you see that there are gainers and that there are losers. And what are the sectors that have lost most? Retail, transportation, restaurant, hospitality, recreation. Why? Because the richest households that have most of their spending in this non-essential sector have dropped their spending more. But who is employed by those sectors? Those are exactly the low earner. Those are exactly the people at the bottom of the income distribution that are seeing the largest drop, the largest decline in income. This implies that there is a short circuit. There is a large amount of saving at the top of the income distribution that is preventing to reach and consume on those sectors which employ low-income earners, which therefore do not receive their income as a result of the fact that high-income households have dropped their spending in those categories. So what we have learned from the economic experience that this crisis is unprecedented. An order of magnitude as we have never seen before, much larger than the Great Recession of 2007, 2009. High earners are the ones that are contributing most to the drop in consumption, and they are using these to increase their saving. They can do that because most of their basket is on non-essential goods and services like restaurant, traveling, and so on and so forth. At the other end of the income distribution, low earners are seeing a larger decrease in their income, but they can drop their consumption by much less. Because most of their basket is on essential items. In other words, they are forced to increase their borrowing to put food on their table. But crucially, the low earners are seeing a larger drop in their income because they are employed in those very sectors, restaurant, transportation, hospitality, recreation, in which the high income households are dropping their consumption most. Any economic policy that wants to drive us away from the recession and into a recovery needs to break . this short circuit between high-income household with a large marginal propensity to save and low-income household with a large marginal propensity to consume. Thank you very much.
The COVID-19 pandemic has triggered very widespread changes in human behavior. And it's also taken away attention from another crisis, which is also building, which is the climate crisis, which is on a different timescale to COVID-19, but nonetheless, a crisis which will have very far-reaching implications for humanity unless we address it. So COVID-19 has triggered economic recession, unparalleled for many, many decades. And it's brought into very sharp focus the need for recovery policies. And these recovery policies must integrate health, equity, and sustainability. Governments around the world have imposed policies which essentially are costing the world economy many trillions of dollars. In order to protect public health. So in emerging from the COVID-19 crisis, it makes sense to continue safeguarding health through appropriate policies for the economy, for the environment, and human health. You can see from this slide that dramatic changes in the economy are occurring and are predicted to continue. And if anything, in percentage terms, they're likely to have very big effects in both the advanced and the emerging economies. Obviously, the emerging economies, because more people are living below the poverty line, they're likely to have big impacts on the poor. But paralleling the COVID crisis, we've also seen decreases in air pollution in many countries. It depends a little bit where we are in the world and which pollutant we're looking at. But in many cases, the changes have been very dramatic. And this slide just illustrates one of those, and that's in India. As you can see, the nitrogen dioxide levels over India have declined quite dramatically between January and late March, early April. And that's resulted in a view of the Himalayas from parts of northern India that have not been seen for many, many decades. And this phenomenon has been seen, of course, in other situations as well. In many parts of the world, we've seen people commenting on how nature has rapidly rebounded during the COVID crisis. And the question then is, whether we can sustain these changes over time. So this is a slide slide from a recent paper in Nature Climate Change, which shows us how the CO2 emissions, and CO2 is the most important greenhouse gas, has declined during the COVID pandemic. You can see that China, as we would expect, has preceded the rest of the world, and that that's the bump on the left there in February, and that surface transport has contributed the largest, but other sectors as well, industry, power, aviation, and of course public sector as well, with a modest increase in residential energy use and therefore CO2 emissions, CO2 being the most important greenhouse gas. As I mentioned, China shows a different pattern to other parts of the world. It decreased earlier, but started to rebound earlier as well. And then the USA and Europe following behind, with the USA probably going to be having a longer trail because it's still in many parts of the country in lockdown. So there's no reason, unfortunately, to suppose that as we emerge from COVID, that CO2 emissions will necessarily remain low, or nor will air pollution, in the absence of policies that guide the economy towards a zero carbon future. So what are the risks from climate change? Elevated climate change. Well, these are manifold. I don't have time to go into detail, but this is from the IPCC. A 1.5 degree report, and you can see that as temperatures increase towards 2 degrees, which many climatologists tell us is the threshold which we must remain below, ideally, but 1.5, then the risks escalate, and they're summarized on this slide. Many of them have implications for human health, including direct effects of heat, coastal flooding, food, crop yields, and so on. So in the face of this climate emergency, which is coming very rapidly over the horizon at us, which will impact on all parts of the world, but particularly, of course, on low middle income countries who have in many cases contributed least to greenhouse gas emissions. The WHO has launched a manifesto for a healthy green recovery, which includes 6 points summarized on this slide, including the protection and preservation of nature, investing in essential services, including healthcare, of course, ensuring a quick, healthy energy transition for zero carbon energy economy, promoting healthy, sustainable food systems, building livable, sustainable, low carbon cities, and importantly, stop using our money, taxpayers' money, to fund pollution. At the moment, we put about $400 billion a year direct subsidies into fossil fuels. So we're subsidizing pollution, we're subsidizing climate change, and we have to stop that. Nature-based solutions are important for health and for sustainability. Here's some examples on this slide. Forest conservation can reduce disease.